Hi, I'm Pat Iyer, the chief editor of a book called Medical Records Analysis, the fourth volume. The authors in this book are legal nurse consultants who are sharing their expertise with attorneys and other legal nurse consultants about the topic of analyzing medical records. One of our authors, Lori Mollmann, is here with me now and will share a little bit about her chapter. Lori, what is the subject matter of your chapter?
Well, thank you, Pat. The subject matter for my chapter was about analyzing medical documentation concerning agitation, ICU delirium, and sedation in critically ill patients.
And why is this such an important topic for attorneys and legal nurse consultants to understand?
Well, I think when you're analyzing a record, there are certainly key things that you can pull out of the record that, especially when evaluating damages, regarding people who are requiring mechanical ventilation and sedation. It has to be coordinated so that you're getting the right mix. Otherwise, it can prolong stays in the ICU. It can prolong time on mechanical ventilation and have lasting residual effects with some people who experience this delirium, thinking that people are out to get them, people that sometimes can actually harm themselves if these things are not managed properly.
How common of an issue is ICU delirium?
It can occur in up to 50% of people who are not requiring mechanical ventilation, and in some cases up to 80% in patients who are requiring mechanical ventilation.
And what you're describing is a condition that adds to the misery of a critically ill person who is bombarded with stimuli, confined to bed, out of control, exposed to sights and sounds and people with very little autonomy. And now you're mixing in a psychotic framework, a psychotic mindset that just makes it so much tougher.
Absolutely. And when people do start to, I would say, wake up from some of these episodes and they're made aware of some of the things that occurred or the way they felt, or that it's just something that as clinicians we really have to try to prevent and or mitigate as much as we can.
There's lots of helpful tips in Lori's chapter. Be sure to get a copy of your book, Medical Records Analysis, Volume 4, at the link directly below this video, lnc.tips/MRA4. You'll find it useful to get an insight about a very difficult aspect of being a patient in a critical care unit, and what are the clinical implications of experiencing ICU psychosis. Thanks so much.